I'm about to show you something that could save your legs and possibly your life. Something so simple, you can do it right now while sitting in your chair, yet so powerful that it's reversed circulation problems that doctors said were irreversible. After 26 years as a vascular surgeon, I've seen things that would keep you up at night. I've amputated toes, feet, and entire legs from people who waited too long, who ignored the warning signs, who believed their cold feet and leg cramps were just part of getting older. But here's what makes me furious. Most of these amputations were completely preventable. The patients I lost limbs on didn't have some rare disease. They had poor circulation, a condition that affects over 8 million Americans over age 60, and they simply didn't know about the one exercise that could have changed everything. The medical establishment doesn't talk about this enough. Physical therapists rarely teach it, and pharmaceutical companies certainly don't want you to know that a simple movement you can do for free might work better than the expensive medications they're selling. What I'm about to share isn't some miracle cure or magic bullet. It's based on solid vascular science, proven in clinical studies, and I've personally witnessed it transform hundreds of my patients' lives. By the end of this video, you'll know exactly how to perform this exercise, why it works so dramatically for aging circulation, the critical mistakes that make it useless or even dangerous, and the warning signs that mean you need to see a doctor immediately before attempting any exercise. This could literally be the difference between keeping your legs and losing them. Stay with me, because what you're about to learn, most people discover far too late. Let me start by telling you about Robert. He was 68 years old, a retired postal worker who loved walking his golden retriever every morning. But over the course of 6 months, those walks became shorter and shorter. His calves would cramp painfully after just a block. His feet felt ice cold even in summer. At night, his legs ached so badly he couldn't sleep. When he finally came to my office, I could barely feel the pulse in his feet. His ankles were discolored, almost purple. The circulation in his legs had deteriorated to the point where tissue damage was beginning. I'll be honest with you, I was worried. Patients like Robert often end up needing surgery, stents, or worse. But before we went down that road, I taught him one exercise, just one. I told him to do it 3 times a day for 5 minutes each session. He looked at me skeptically. How could something so simple fix a problem this serious? But he was desperate, so he tried it. 4 weeks later, Robert walked into my office with a smile I'll never forget. The cramping had decreased by 70%. His feet were warm for the first time in months. He'd walked 2 miles that morning without stopping. When I checked his pulses, they were noticeably stronger. The exercise had literally reopened the tiny blood vessels in his legs, creating new pathways for blood to flow. Now, you might be wondering, what is this magical exercise? Before I reveal it, you need to understand why your circulation gets worse after 60 and why traditional approaches often fail. Your circulatory system is like a vast network of highways, with your arteries as the main roads carrying oxygen-rich blood from your heart to every cell in your body. After decades of use, these highways develop problems. Cholesterol deposits narrow the lanes, the vessel walls stiffen and lose flexibility. Tiny capillaries, the small side streets, start to collapse and disappear. Your legs face the biggest challenge because they're the furthest from your heart. Blood has to fight gravity to get down there, and then fight even harder to get back up. When you're young, your heart is strong enough and your vessels are elastic enough to handle this easily. But after 60, especially if you have diabetes, high blood pressure, high cholesterol, or if you smoke, this system starts to fail. The medical term is peripheral artery disease, or PAD, and it's devastatingly common. Studies show that approximately 1 in every 5 people over 60 has some degree of PAD, though many don't realize it yet. The standard medical approach is medication to thin your blood or lower your cholesterol, and in severe cases, surgery to bypass blocked arteries or insert stents. These treatments can be life-saving, don't get me wrong. I've performed hundreds of these procedures, but they don't address the root problem. They don't rebuild the microcirculation, those tiny thousands of vessels that actually deliver oxygen to your muscle cells. And here's the thing that shocked me when I first learned it during my training. Your body has an incredible ability to create new blood vessels, a process called angiogenesis. When one pathway gets blocked, your body can literally grow new roots around the blockage. But this only happens if you give your body the right stimulus. That stimulus is the exercise I'm about to teach you. It's called ankle pumps with leg elevation, and it works by creating a powerful cycle of blood flow restriction and release that triggers your body's natural vessel-building mechanisms. Let me explain exactly how to do it, and more importantly, why each element matters. You'll need a place to lie down, a pillow or cushion, and about 5 minutes of uninterrupted time. That's it. No special equipment, no gym membership, no expensive gadgets.
Here's the step-by-step process. First, lie flat on your back on your bed or on the floor with a yoga mat. Place a pillow or two under your calves so your legs are elevated about 45 degrees above your heart. This position alone starts improving venous return, helping blood drain from your legs back to your heart. It also reduces the workload on your arterial system. Now comes the critical part. While your legs are elevated, begin pumping your ankles. Point your toes away from you as far as they'll go. Hold for 2 seconds, then flex your feet back toward your face as hard as you can. Hold for 2 seconds. That's 1 repetition. You want to do this continuously for 5 minutes. I know it sounds simple, almost too simple to work, but here's the science. When you point your toes, you're contracting your calf muscles, which squeezes the veins in your lower legs and pushes blood upward. When you flex your feet, those muscles relax and fresh blood rushes back in to fill them. This creates a pumping action, essentially turning your calf muscles into a second heart. Doctors call this the calf muscle pump, and it's one of the most important mechanisms for leg circulation. But there's more happening than just mechanical pumping. The repeated muscle contractions also trigger the release of nitric oxide from the lining of your blood vessels. Nitric oxide is a powerful vasodilator. It causes blood vessels to relax and widen, allowing more blood to flow through. Studies have shown that exercises promoting muscle pump activity can increase nitric oxide production significantly, improving circulation not just during the exercise, but for hours afterward. The elevation component is equally crucial. When your legs are raised above your heart, gravity helps drain pooled blood and reduces swelling. This decreased pressure in your leg veins improves the efficiency of your arterial system. It's like reducing traffic on a congested highway. Everything flows better. Now, here's where most people make critical mistakes that completely sabotage their results. Mistake number 1 is not elevating high enough. If your legs are only slightly raised, you're not getting the full gravitational benefit. The angle should be approximately 45 degrees or more. Your feet should be noticeably higher than your heart. Use enough pillows or cushions to achieve this, even if it feels a bit awkward at first. Mistake number 2 is pumping too fast. I've had patients who rush through the ankle pumps like they're in a race, doing 100 repetitions in a minute. That defeats the purpose. The goal isn't speed, it's creating a strong, rhythmic pumping action. Slow and controlled is better. 2 seconds pointing, 2 seconds flexing. Count it out loud if you need to. This controlled tempo maximizes the muscle contraction and the subsequent vasodilation. Mistake number 3 is not doing it consistently. This isn't a one-and-done solution. You need to perform this exercise at least twice a day, preferably 3 times, for a minimum of 5 minutes each session. Think of it like taking medication. You wouldn't take your blood pressure pill once and expect your pressure to stay down forever, right? Same principle here. Your circulation needs regular stimulation to maintain and improve. Mistake number 4 is ignoring pain signals. Now, some mild discomfort or cramping when you first start is normal, especially if your circulation is poor. But sharp pain, severe cramping that doesn't resolve when you stop, or any numbness or tingling that persists is a red flag. Stop immediately and consult your doctor. You could have a blood clot or severe blockage that needs medical attention. Mistake number 5, and this is huge, is assuming this exercise alone will fix advanced circulation problems. If you have severe PAD, non-healing wounds on your feet, or if you've been told you need surgery, this exercise is a supplement to medical treatment, not a replacement. Always work with your physician. Use this as part of a comprehensive approach that might include medication, diet changes, smoking cessation, and professional medical procedures when necessary. Let me tell you about another patient, Eleanor. She was 74, diabetic, and suffering from terrible leg cramps at night that would wake her up screaming. Her circulation was so poor that her feet were always cold, and her toenails had turned thick and yellowish from lack of oxygen. She'd seen multiple doctors who prescribed various medications, but nothing seemed to help. When I taught her the ankle pump exercise, she was skeptical but desperate enough to try anything. She committed to doing it religiously 3 times a day, morning, afternoon, and before bed. Within 2 weeks, Eleanor called me almost in tears. The night cramps had reduced by half. After 6 weeks, they were almost completely gone. She could sleep through the night for the first time in 2 years. Her feet felt warmer. Even her toenails started growing normally again as the circulation improved. She told me, "Dr. Mitchell, this exercise gave me my life back. I can't believe something so simple made such a huge difference." Stories like Eleanor's are why I'm so passionate about sharing this information. Now, I want to take this a step further and give you 3 advanced variations that can amplify the benefits even more once you've mastered the basic exercise. These are for people who've been doing the standard ankle pumps for at least 2 weeks and want to maximize their circulation gains. Variation number 1 is resistance ankle pumps. Instead of just moving your feet through the air, loop a resistance band around the ball of your foot. When you point your toes, you're pushing against the band's resistance. When you flex back, the band provides resistance in the opposite direction. This increased muscular effort generates more forceful pumping action and even greater nitric oxide release. Start with a light resistance band and only progress to heavier resistance if you can do so without pain. Variation number 2 is alternating ankle pumps. Instead of pumping both feet simultaneously, alternate left and right. Point the right foot while flexing the left, then switch. This creates a more dynamic, wave-like pumping pattern that can be particularly effective for improving lymphatic drainage in addition to blood circulation. Some of my patients find this variation helps even more with reducing ankle swelling. Variation number 3 is combining ankle pumps with deep breathing. As you point your toes, take a deep breath in through your nose. As you flex your feet, exhale slowly through your mouth. This synchronization of breathing with movement has 2 benefits. First, deep breathing activates your parasympathetic nervous system, which promotes vasodilation throughout your entire body, not just your legs. Second, the rhythmic breathing helps you maintain a steady, controlled pace with the ankle movement. Plus, deep breathing increases oxygen in your blood, and well-oxygenated blood is exactly what your leg tissues are craving. But here's something critical that most doctors never mention. Exercise alone isn't enough if you're sabotaging your circulation with poor lifestyle habits. Let me be blunt. If you smoke, you're essentially pouring poison into your blood vessels every single day. Smoking causes your arteries to constrict, damages the vessel lining, and accelerates plaque buildup. No amount of ankle pumps can overcome that damage if you continue smoking. Quitting is non-negotiable if you want healthy circulation. Similarly, uncontrolled diabetes is a circulation killer. High blood sugar damages the delicate lining of your smallest blood vessels, the capillaries. Over time, this leads to diabetic neuropathy and poor wound healing. If you're diabetic, you must keep your blood sugar in the target range your doctor recommends. Diet, medication, whatever it takes, your legs depend on it. High blood pressure also matters. Chronic hypertension stiffens your arteries, making it harder for blood to flow through them. Monitor your pressure, take your medications as prescribed, reduce sodium intake, manage stress. All of these factors work together. Nutrition plays a bigger role than most people realize. Certain foods can actually improve circulation. Fatty fish like salmon and mackerel are rich in omega-3 fatty acids, which reduce inflammation and improve vessel flexibility. Leafy greens like spinach are high in nitrates, which your body converts to nitric oxide, that crucial vasodilator I mentioned earlier. Berries contain antioxidants that protect your blood vessel walls from damage. Garlic has been shown in studies to improve circulation and reduce blood pressure. On the flip side, avoid trans fats, excessive sugar, and highly processed foods. These promote inflammation and plaque formation. Hydration is another overlooked factor.
When you're dehydrated, your blood becomes thicker and more difficult to pump. This puts extra strain on your heart and reduces circulation to your extremities. Aim for at least 8 glasses of water a day, more if you're active or it's hot outside. A simple way to check: your urine should be pale yellow. If it's dark, you need more fluids. Now let's talk about warning signs you absolutely cannot ignore. These are symptoms that mean you need to stop everything and see a vascular specialist immediately. Warning sign number 1, non-healing sores or wounds on your feet or legs, especially if they're painless. This could indicate such poor circulation that your tissue is literally dying. Without urgent intervention, this can lead to gangrene and amputation. I've seen it happen, and it's devastating. Warning sign number 2, sudden, severe pain in your leg, especially if it's accompanied by coolness, paleness, or a feeling like your leg is going numb. This could be an acute arterial blockage, essentially a heart attack in your leg. This is a medical emergency. You have a limited window, sometimes just hours, to restore blood flow before permanent damage occurs. Warning sign number 3, one leg that's significantly more swollen than the other, particularly if it's also red, warm, and painful. This could be a deep vein thrombosis, a deep vein clot in one of the deep veins of your leg. If that clot breaks free and travels to your lungs, it can cause a pulmonary embolism, which can be fatal. You need immediate medical evaluation. Warning sign number 4, pain in your legs that gets worse when you elevate them and better when you dangle them down. This is the opposite of normal and suggests severe arterial blockage. Most people feel better when their legs are elevated because it helps venous drainage. But if elevation makes things worse, it means your arteries are so blocked that gravity is the only thing helping blood get down to your feet. That's critical limb ischemia, and you need intervention fast. Warning sign number 5, color changes in your feet that don't resolve. If your feet are constantly purple, red, or even black in spots, that's a sign of serious circulation compromise. Your tissue isn't getting enough oxygen. This can progress to tissue death if not addressed. Here's the protocol I give all my patients. Start with the basic ankle pump exercise, legs elevated, 5 minutes, 3 times a day. Do this consistently for 2 weeks. During those 2 weeks, pay close attention to your symptoms. Are your legs cramping less? Are your feet warmer? Can you walk further without pain? These are all positive signs. After 2 weeks, if you're seeing improvement and have no pain or warning signs, consider adding one of the advanced variations I mentioned.
Continue this routine for at least 3 months. Why 3 months? Because that's typically how long it takes for significant angiogenesis, new blood vessel formation, to occur. You're not just improving the flow through existing vessels, you're literally building new ones. That takes time, but the payoff is worth it. Patients who stick with this exercise for 3 months often report dramatic improvements: better walking distance, less pain, warmer feet, improved healing, better sleep. The benefits compound over time. I also recommend tracking your progress. Keep a simple journal. Note how far you can walk before cramping. Rate your pain level on a scale of 1 to 10. Describe how your feet feel. Take photos of any skin discoloration or wounds so you can see objectively if they're healing. This documentation helps you see progress even when improvements are gradual. It also provides valuable information for your doctor. Now, I want to address the elephant in the room. Some of you are thinking, Dr. Mitchell, if this exercise is so effective, why hasn't my doctor told me about it? That's a fair question. The truth is, modern medicine is heavily tilted toward pharmaceutical and surgical interventions. Don't get me wrong, I'm a surgeon. I believe in surgery when it's needed. But our medical system doesn't incentivize doctors to spend time teaching exercises. A 15-minute office visit doesn't allow for detailed instruction on movement therapy. It's faster to write a prescription or schedule a procedure. Additionally, many doctors simply aren't trained in this. In medical school and residency, we learn extensively about medications and surgeries, but exercise therapy often gets minimal attention. Unless a doctor has specifically sought out this knowledge or works closely with physical therapists, they might not be aware of how powerful these simple interventions can be. That's not an excuse, but it's the reality. This is why you have to be your own advocate. You have to educate yourself and ask questions. Let me share one final story. one that honestly brings me to tears every time I think about it. I had a patient named Thomas, 81 years old, who came to me with such severe PAD that I truly thought we'd have to amputate his right leg below the knee. The circulation was that bad. His foot was cold, discolored, and he had a small ulcer on his heel that wouldn't heal. Standard treatment protocol would have been to try to stent or bypass the blockage, and if that failed, amputation to prevent the spread of gangrene. But Thomas was terrified of surgery. He'd seen friends go through amputations and lose their independence, end up in wheelchairs or nursing homes. He begged me for any alternative, anything that might save his leg. I was honest with him. I told him the odds weren't good, but if he was willing to commit completely, we could try an aggressive, conservative approach. Ankle pumps 4 times a day, strict blood sugar control, a complete diet overhaul, smoking cessation, and close monitoring. Thomas did everything I asked and more. He set alarms on his phone to remind him to do his exercises. His wife helped prepare circulation-boosting meals. He quit smoking after 60 years. And slowly, miraculously, things started to change. The ulcer on his heel began to heal. Color returned to his foot, his pain decreased. After 6 months of this regimen, combined with some medications, Thomas walked into my office on his own 2 legs. The leg we thought we'd have to amputate was saved. He lived another 4 years, walking, gardening, playing with his great-grandchildren. He passed away peacefully at 85 with both his legs intact. I'm not saying this exercise is a miracle cure for everyone. Thomas's case was exceptional, and his extraordinary dedication played a huge role. But it illustrates a fundamental truth. Your body has remarkable healing capacity if you give it the right tools. Don't underestimate the power of consistent, purposeful movement. Don't assume that decline is inevitable just because you're getting older. Here's my challenge to you. Starting today, commit to this ankle pump exercise. Set a specific time, maybe first thing in the morning, after lunch, and before bed. Make it as routine as brushing your teeth. Get your spouse or a friend to do it with you for accountability. Track your progress for 30 days and see what changes. I truly believe if you commit to this, you'll be amazed at the difference. Your legs will feel better, you'll move more easily, you might even avoid surgeries or medications you thought were inevitable. Before I close, I want to remind you that everything I've shared today is based on my clinical experience and current medical research. But I'm not your doctor. I don't know your specific medical history. So please, before starting any new exercise program, especially if you have known circulation problems, heart disease, or other serious health conditions, talk to your physician. Show them this video. Ask if ankle pumps are safe for you. Get their guidance. If you found this information valuable, please share this video with anyone you know over 60 who struggles with leg pain, cold feet, or circulation issues. This could genuinely save someone's legs, maybe even their life. And subscribe to this channel because I'll be sharing more evidence-based strategies to help you stay healthy, active, and independent as you age. Thank you for watching. Now go elevate those legs and start pumping. Your circulation is counting on you.